Good morning, everyone. This is Nick Novak, Vice President for Communications and Marketing at Wisconsin Manufacturers and Commerce. Thank you so much for joining us once again for another COVID-19 update webinar. Obviously, we've done some special scheduled webinars this week with some of the decisions coming down from the Supreme Court, striking down the safer at home order. And with that, there's a lot of questions about reopening businesses, returning to work, what needs to be done. And from WMC's standpoint, we have been talking for weeks about how we can safely return to work and reopen businesses and reopen the economy and make sure that we are still doing what is necessary to protect our employees, to protect the public, and ensure that the individuals feel confident going out to places of business, even with the COVID-19 virus still in effect. Obviously, the Supreme Court's ruling does not eliminate COVID-19. The virus still exists. And so that just means that businesses need to take the responsibility of extra safety steps and making sure that they're doing everything necessary to protect their employees. So we're really excited that Wisconsin Safety Council, which is a part of WMC, is going to go through some steps that businesses can take as we all begin to return to work, whether that be in an office setting, a manufacturer, or some different type of business here in Wisconsin. And so we have Laura Wade, who's a senior safety manager with Wisconsin Safety Council. She will go through 8 steps to keep employees safe. This is a guidelines and best practices publication that Wisconsin Safety Council actually released earlier this week, talking about what businesses could do to prepare to open and what they can do once they actually are open. All of this is based on best practices and guidelines from federal agencies, including OSHA, CDC, and NIOSH, and working with our partners at the National Safety Council as well. And so these are meant to be guidelines. They will change as the CDC updates their own guidelines and as OSHA updates their own guidelines. So we do encourage you to check back often and work with Wisconsin Safety Council on what is best for your company as you look to keep your employees and your customers safe as you reopen and return to work. So without further ado, I want to bring Laura into the conversation here to talk about what companies can do to keep their employees safe. So Laura, please take it away.
Thank you, Nick. Yeah, as we get ready to open up the economy for Wisconsin and get everything back to functioning somewhat normally, we want to make sure that we're minimizing the risk of exposure to employees as much as possible. Like you said, there's just because businesses may be opening and the safer at home order is not in place anymore, that doesn't mean that the virus has gone away or that the risk has gone away. So we want to make sure that companies, businesses are still doing what they can do to best minimize that risk to their employees. So we've outlined 8 simple steps, simple maybe, but very detailed, to make sure that companies follow some sort of a plan and are looking at several key areas before they reopen. Now, reopening plans will take time to develop. So if you're looking to reopen your business anytime soon or within the next 3 to 4 weeks, we encourage you to develop your plans early. So these steps will help you to do that. This will walk you through as a guide to make sure that you're thinking about all the things you need to be thinking about as you develop your plans for reopening. Go ahead, next slide. So step 1, identify key members of your restart team, especially if you guys have been closed for a significant amount of time. So mid-March is kind of when everybody went into the safer at home status. A lot of companies are closed or have not had people in the building for a while. So now is the time to identify key members of your restart team, key people that will be performing certain roles with your restart, so that the work is spread out and it's not just overwhelming for 1 or 2 people. So things that you want to be looking for: employee access control. who's going to work around those schedules to maintain social distancing? Maybe you have 3 shifts or 2 shifts that you need to make sure that you're providing a gap for, or maybe you have visitors or vendors that come into your building that you need to make sure that you control access to as well. So assign somebody to be that access control lead. You'll also want somebody to be that virus prevention and protocols lead, somebody who will develop your policies for how you're going to identify sick people in your workplace. What is the protocol for employees to either self-monitor for symptoms, or how are you as an employer going to monitor for symptoms? And then what do you do with those folks if somebody does need to be isolated while they're waiting to go home? So assign somebody that particular role so that nothing falls off and gets misplaced or forgotten. You'll also want somebody to be a sanitation and disinfection lead. We recommend that you fully clean, sanitize your building before you reopen. So that means typically all hard surfaces, desks, worktops, tabletops, workstations, high-touch surfaces such as handrails and doorknobs, bathrooms, all of that great stuff, break rooms. Make sure that you have something in place there to fully clean and disinfect before you open. But then you'll also want to have more frequent cleaning and disinfecting throughout your workday. So have something, if you have 2 shifts, 3 shifts, make sure that you're disinfecting between shifts and also hitting those high touch surfaces periodically throughout the day. You'll want somebody to be communications and training lead, somebody who's going to handle scheduling the training for employees, not just for employees as they come back to work, but you also will need training for all of these leads as well, so that they can understand what their role is in the reopening plan and what their responsibilities are. Everybody should receive training before they come back to work. On various things, policies, procedures that you've implemented, as well as any COVID-19 related information. And then somebody who's going to manage that PPE materials, cleaning equipment, supply procurement, and managing inventory. We know that there's a lot of gaps in the supply these days. It's difficult to source surgical masks and disinfectant wipes and things like that. So you'll want somebody who's assigned particularly to that so that they can check with your normal supply people, with your normal vendors that you get those things from. And then if they don't have the supplies that you need, then you can research alternative vendors and secure supplies. And then they'll manage that inventory. It's recommended that companies obtain at least a 30-day supply of inventory for PPE and cleaning supplies. So you'll want somebody who's going to particularly watch that. Next slide. So step 2, develop your policies for identifying your sick people and isolating those folks from the facility and from other coworkers until they can be sent home. So if you have somebody that does develop COVID-19 or related symptoms, you need to have a policy in place that helps protect the other coworkers and other visitors, vendors, or contractors who might be in your facility. So develop that policy early and make sure you train it to everybody so that they aren't, they know what to look for. They know that they're self-monitoring for symptoms. They can call in if they do develop symptoms, maybe over a weekend or outside of work, they can call in and not even show up. Or if they need to know what to do if they start to develop symptoms while they're at work so that they can minimize exposure to their coworkers. Everybody wants to keep everyone safe. So I know that's top of mind for everybody. They just need to know exactly what is expected, what they need to do. So develop that policy early and train that to everybody before you open up again. Next slide. You're going to want to make sure you obtain necessary supplies of your PPE and cleaning materials. Like I mentioned, this is going to be difficult just because of the situation that we're in. PPE supplies and like disinfectant wipes and sprays, those are really difficult to come by. Check with several different vendors, with your normal supply vendors, and see if they have the supply on hand. If they don't, they may be able to give you options or or let you know of alternative sources. But you're going to want to make sure you get on this task early and stay on it often, just because of the constantly changing nature of that supply system. So make sure that you identify your lead for this area, and that person should have the capability to make purchases, probably larger purchases than they normally would. So sometimes this involves upping a credit limit on a company credit card, or having to expedite financial approval through faster channels than normally would be required. Next step. So step 4, clean and disinfect your facilities. Again, before you open, do a full cleaning and disinfection of your facility. If you have already been open but with very minimal staff, you should still go ahead and perform this step before everybody else returns to work. So clean all of those hard surfaces, tabletops, worktops, desks, bathrooms, handrails, door handles, things like that. And then you're going to want to make sure that you maintain a schedule for periodic cleaning and disinfection throughout the day as well. Throughout the day, probably every 4 hours, especially hitting those high touch surfaces. And then between shifts, you'll want to make sure that you're doing a clean of all like operating equipment, anything that folks have to touch. So if it's machinery and equipment, buttons, handles, things that they need to touch, you want to make sure that you're getting those cleaned and disinfected between each shift as well. Next slide. Step 5, this one is a really key step in your reopening plan and might take some time for you to do. So this is one thing that you're going to want to get on fairly early as well. So completing a risk assessment to understand the exposure risk to each type of employee in your workplace. This will help you identify what controls you need to implement to minimize that risk even further. So OSHA designates 4 risk categories: very high risk exposure, high risk, medium, and then low. The high exposure risk and very high exposure risks, those typically pertain to healthcare workers who are working with known COVID-19 exposure, or people that are infected with the disease, and there is that known risk of exposure. The medium exposure risk and low exposure risk are pretty much for everybody else. Those folks that are working with the general public who may not have COVID-19, but also may. So there's that question there of, somebody may not be showing symptoms, but they may be infected. This is going to be your medium exposure risk and low exposure risk. For medium exposure risk, this will typically be people who have to work within 6 feet of each other, who cannot maintain social distancing all the time, or they may be people that are working with the general public. So folks that are doing maybe deliveries or having to come into your building to perform different contracting tasks and stuff like that. Low exposure risk is going to be those employees that are in the category of essentially working alone or working by themselves. They're not in contact with the general public. They're not really working with a coworker or close to a coworker. Those are going to be your low exposure risk employees. But performing that risk assessment to identify where your employees fall, that's going to be key for you in being able to identify your next step. So go ahead, next slide. So once you identify the risk level for your workers, and keep in mind that different employees in your facility may fall into a different risk category. So you may have different controls that are in place for some employees and not for others. So just keep that in mind. Once you've determined the level of risk, then you're going to want to make sure that you implement controls for those employees. So controls for all risk categories. This is where your basic plan for infection prevention measures comes into play. This is the plan for identifying people who are sick. self-monitoring, having employees self-monitor for symptoms, for isolating sick people from all of their coworkers before they're being able to be sent home. This will be your plan for social distancing in your workplace, making sure employees have that option or have the ability to stay 6 feet away from each other. So basic infection prevention measures, that's going to apply to everybody. That'll be included in your plan. And then low risk controls should be administrative controls, monitoring public health communications, ensuring that workers have access to that information. As we know, things are changing daily to weekly with recommendations coming out from OSHA and the CDC. So monitoring those changes constantly and being able to communicate those changes to employees is key there. People in low exposure risk jobs do not necessarily need PPE. So masks would be an optional item for somebody who is in a low risk category. Now, this is somebody who is not working with the general public, typically works alone, is not going to be within 6 feet of anybody else, and has a very low risk of exposure. For medium risk, so we'll focus on the low and medium risk. Engineering controls should be installing physical barriers such as clear plastic sneeze guards where feasible. If you're a retail store, you've probably seen these at cash registers to try to put up a barrier between employees and customers. But it can also apply to work areas where you have people working within 6 feet of each other. So if you have an assembly line where employees have to stand fairly close to each other, then you can put up the clear plastic sneeze guards in between or some sort of barrier between each employee so they can still maintain their position on that line, but they have some sort of separation between them and the next person. Administrative controls for medium risk exposure will be consider offering face masks to employees. This is going to, it'll be basically your decision whether you're going to make masks mandatory or not. So this will be determined when you do your risk assessment. If you find during your risk assessment that you do have high risk or an increased risk of exposure, which because employees are working too close to each other, then you may want to make it mandatory to have employees wear face masks. In the event of shortage of masks, reusable face shields, the face shields can be used as an alternative, but just keep in mind because they don't provide full coverage around the face, there could be opportunity for exposure, up under the face mask. And then when you're selecting PPE, make sure that you consider factors like function, fit, if it's reusable or disposable, and then what the cost may be. It might be actually more cost effective to invest in more expensive reusable PPE versus the disposable. So keep that in mind as well when you're selecting your PPE. All of that should be determined, PPE and other engineering controls should be determined, or you should make that decision once you complete your risk assessment for the employees in those jobs. I'm not going to go into too much detail about the high risk and very high risk because those typically will be healthcare facilities or funeral homes, mortuaries, morgues, those kind of places. And those guys have already been fully covered with education on those steps. But if you have questions on those, feel free to reach out to us. That information is also included in the guide that's on our website, and that's wisafetycouncil.org. So you can find that full guide there. Okay, Nick, go ahead and go to the next slide. So training is going to be key. You'll develop your policies and procedures. You're going to implement your cleaning schedules. You'll probably be staggering shifts to make sure that you're giving employees as much of a gap between each other as possible. And then you're going to be selecting PPE based on the risk for those jobs. All of that is going to need to be trained to your employees before they come back to work or on that first day of work. So it's recommended employees or folks that you assign to those key roles of your restart team, that they get training before everybody comes back to work. So you can do that via Zoom or whatever other technology platform that you've been using, or through email, however you want to get that information out to them. Make sure they understand their roles and responsibilities under your reopening plan. But then for all the other employees that are coming back to work, on day one, before you start operations, you should be giving them training on all of the stuff that you've implemented as well. So develop your training plan, make sure everybody understands fully what the new policies and procedures are, what PPE they should be wearing, how they need to wear it, what the disposal guidelines are, and then also if you're asking them to self-monitor for symptoms at home, let them know what the signs and symptoms are for COVID-19, what you expect as far as reporting, how they should report any signs or symptoms, whether they happen out of work or during work, and then what will happen if they do happen to show symptoms at work, what the isolation procedure is until they're able to be sent home. So train your employees, make sure that they understand what those new expectations are, and then everything will be a lot more successful and smooth running. Next slide. Finally, you're going to monitor the situation and ensure compliance. Things are changing day to day or week to week, month to month. So as things change, you're going to want to monitor that very closely. So check back, refer to OSHA, NIOSH, CDC, National Safety Council, Wisconsin Safety Council. We will put out information as well as things change. So check back and monitor the situation constantly. You'll also want to check your local guidelines for your county or your area that you're in, because those may change and shift as well. We know that some counties have implemented their own orders, so check with them and find out what the details are of those orders, so that you can make sure that you're in compliance and you're operating as best you can under those guidelines. So those are our 8 steps for returning to work. Again, it's simple 8 steps, but it is a lot of detail in there. It will take a lot of planning and effort on your part as an employer to make sure that you have all those key parts in place, and that your employees are trained and they understand what to do and how to respond to your new policies and procedures. For additional resources, you can always reach out to Wisconsin Safety Council. Erin Hebner is our executive director. You can also email me. Laura Wade, senior safety manager, will be able to get you as many resources or as much information as we can. Also check, again, CDC, OSHA, and the Wisconsin Department of Health Services also has lots of resources. Those are up here on the screen, but they will also be included in the guide on our website. Again, Wisconsin Safety Council's website is wisafetycouncil.org. So we have a COVID-19 page there where you can find this guide and a bunch of other resources as well. All right.
Well, thank you, Laura, for taking the time to run through the guidelines and best practices there. I know a lot of companies are looking for guidance on what they can do to keep their employees safe. So we appreciate you taking the time. We do have a few minutes for questions now. I know we've received quite a few questions in the chat function on the GoToWebinar platform. So if you do have questions, please feel free to submit them through that process, and we will try to get through as many as we can, trying to keep the webinar to about a half hour today to be respectful of everyone's time. So if you do have a question, please feel free to send that in the chat function. If we can't get to it today, please feel free to contact Erin or Laura, and I'm sure they'd be happy to follow up with you as soon as they can. So Laura, the first question that we have today is going back to when you talked about reopening the business and talking about disinfecting different parts of the facility. Some folks are wondering if they've been closed for an extended period of time. How necessary is that disinfection of their whole building? Well, what's the process for that? And can you give any additional guidance?
Yeah, so we've all seen the CDC's report and several other reports on how long the virus lives on different particular surfaces or in the air. With so much conflicting information out there, it's better to just go ahead and do a wipe down of all your surfaces before you restart. That way you're making sure that everything is good to go, you've done your due diligence, and you're not just leaving it up to chance, hoping that the virus has somehow died off if it was present in your facility before you closed. So it's a good idea, good recommendation just to go ahead and go through all of your common areas, making sure you're wiping those surfaces down, high touch surfaces especially. And then as employees come back to work, they can go ahead and wipe down their particular work areas with disinfectant wipes or spray. Now, the types of cleaner that you can use, you want to check the EPA list of approved disinfectants that do kill the COVID-19. So not everything is effective for that, but the EPA has the list on their website of what to look for when you're sourcing cleaning solutions.
Thanks, Laura. And our second question for today, and I know you touched on this a little bit, and it's in the guidelines posted on our website, but a couple of folks are asking about how the virus can be transmitted through HVAC systems, and if there are additional precautions that companies should be taking with their heating and air conditioning. Is there anything they should be doing prior to opening, and then once they open, things they should be thinking about as far as airflow in the building?
Yes, so OSHA does give good resources on this as well. Because it's still pretty unknown as to how far the virus can be transmitted. We know it can become airborne, but it's still really unknown as to how far it can go or be transmitted or travel through HVAC systems. So OSHA does recommend that you change your HVAC filters before you reopen, to go ahead and make sure that those are cleaned. And then you should also, if it's possible, increase your fresh air intake to make sure that you're turning over the air in your building more frequently than you normally would have. You check with your vendor, your contractor, or your servicing company that services your HVAC system. They will probably have a lot of additional guidelines as well for that. So check with them and at the bare minimum, get those HVAC filters changed before, and then plan on changing them probably a little more frequently than you normally would for the next several months or however long this lasts.
And our next question comes from a few different folks on the call. A lot of businesses in Wisconsin have individuals who travel either for sales or for, if they have multiple facilities, they might be traveling between the facilities here in Wisconsin. Is there any guidance on what employees can do and what employers can do to keep those folks safe while traveling from facility to facility, and what to do when they return to maybe their home office?
Yeah, so if you have employees that are traveling between facilities or traveling for sales, et cetera, you're going to want to consider those folks as a medium risk category because they will be dealing with the general public a little more frequently than probably your other employees. So encourage them to wear masks when they're out in public, some type of face covering. If it's not a N95 mask, at least following CDC guidelines for a cloth face mask. They should be wearing those when they're out in the general public. Gloves, typically not necessary because depending on how employees are trained to use gloves, they can actually increase that cross-contamination, between, going and maybe picking up the virus in a store or in another facility, bringing it back to their car and then taking it other places. So frequent hand washing is super important. So they should be washing their hands frequently. As they travel from one facility to another facility, they should be washing their hands with hot water, soap, all that, according to the CDC guidelines for hand washing, which we know, scrub your hands for 20 seconds at least, and then rinse with hot water. So hand washing is important, face mask wearing is important, and then self-monitoring for symptoms is important as well. So they should have probably a heightened awareness of their own condition as they're working. They should be self-monitoring, taking their temperature at home, checking themselves, understanding if they start to develop symptoms, they need to report that back to the company immediately, and then stop all travel and contact their healthcare professional for further guidance. So self-monitoring and then wearing the right PPE, frequent hand washing, that's all going to be key to protecting those people who have more frequent contact with the general public.
And I know we're bumping up on 10:30 here, so I'll try and get in just one final question, and we appreciate everyone taking the time to join us today, and hopefully you'll stick with us for just a couple more minutes. Three different people have asked about sanitizing different parts of their office and EPA recommendations and CDC recommendations, specifically asking about UV lights. That's something that has been talked about in the news and by some other folks, that it can kill the virus, and either more effective or a different way to do it than using some of the cleaning procedures as suggested by the EPA. Is there any guidance from EPA or CDC on that, or would you suggest using the chemical cleaners as you talked about?
Yeah, it's still unknown really which area or which spectrum of UV light will be effective at killing this virus. So there still needs to be a lot of testing and a lot of verification on the effectiveness of it. Plus, the UV lights that are out there on the market can vary, so they can have different spectrums of light at different radiation, powers. So the suggestion or recommendation is to go ahead and use an approved EPA chemical disinfectant for the time being until the effectiveness of UV disinfection does come out there. Now, as we speak, there are several companies that are trying to develop effective UV light disinfection methods and equipment. So this can change pretty rapidly. If they do come out with something that they have determined to be very effective, then EPA certainly will put out that information or post that on their website. But as far as recommendations right now, I've not seen anything that's been recommended. So some options out there, some companies that are advertising for it, but I think we still need to wait for further guidance or further testing from an actual governing body before we take that recommendation.
Well, thank you so much for taking the time to speak with the business community today, Laura. We really appreciate it. Obviously, if folks do have any additional questions that we weren't able to get to today, please feel free to reach out to Aaron Huebner, Wisconsin Safety Council Executive Director, or Laura directly. Their emails are on the screen there, so please feel free to reach out to them, and obviously refer to the Wisconsin Safety Council 8 Steps to Keep Employees Safe guidelines that are posted at wisafetycouncil.org. You can get all the information that Laura presented on today in that publication if you're looking for some additional details. And then, of course, looking to OSHA and the CDC guidelines as those are continuously updated. Now, obviously, Laura, one final question for you, because obviously businesses differ vastly throughout the state of Wisconsin, and they may have different needs or different requirements as far as trying to prevent the spread of COVID-19. If folks who are listening today, if they're looking to get a consultation or learn more about how their specific business can keep their employees safe and take the proper steps, how do they go about speaking with you and the other folks at the Safety Council about getting such a consultation?
Yeah, so we are able to provide that consultation to review your plans, to see what your policies and procedures are, what you've developed. We can review your risk assessments or provide you guidance on how to conduct risk assessments. All of this can be done with about 4 hours of service, and that fee would be $599. so we can work directly with you to understand your business and your needs to mitigate that risk for your employees specifically. So if you have any questions or you're not even sure where to start, you have the 8 steps, but it's still all a bit overwhelming, we can certainly help you out with this and make sure that you can reopen as successfully as possible. So please feel free to reach out to us. We're happy to guide you through that. Our services will be up on our website, or you can reach out directly to me or to Erin Hebner, and we can get you set up with an appointment for that.
Well, thank you, Laura. We really appreciate you taking the time, and thank you to all the businesses who are on the line today for joining us. Obviously, keeping employees safe and instilling confidence in the public and keeping the public safe is a huge priority of Wisconsin businesses as we begin to reopen this economy. So we appreciate you taking the time on this Friday to join us and learn more about what you can do to protect the health and safety of your employees and the general public. So thanks again to Laura, and thanks to everyone for joining us. Please have a safe and a great weekend. Thank you.